The world's first vaccine was against smallpox, one of the oldest and deadliest diseases to afflict mankind. It claimed about 1 in 3 lives that often left survivors blinded and almost certainly disfigured, faces rendered this pitted, pockmarked lunar landscape. It was also a highly virulent, contagious disease. And this importance of smallpox as one of history's greatest killers is rivaled by its significance as the subject of, quote, the world's most triumphant achievement in medicine and public health. The global dissemination of the vaccine led to the eradication of smallpox through a global worldwide campaign led by the WHO. It is to date the only human disease to be eradicated from the globe. Both China and India have very long histories of smallpox. They compete for the orientalizing moniker of the cradle of smallpox. Both had highly well-developed and surprisingly resonant systems of beliefs and practices around the disease. In line with the disease deities that existed across much of the world, China and India had smallpox goddesses, Toshen Nyang Nyang in China and Sitala Mata in India. And the two goddesses are strikingly similar, as you can see, in their visual representations. In both China and India, there were traditional medical systems that saw smallpox as a disease of heat, and patients followed a cooling diet. Beginning around the 16th century, both China and India witnessed the emergence and spread of a new technique, which was embedded within and accompanied by these rituals: the prophylactic practice of variolation. Variola is the smallpox virus. In order to understand how variolation worked, let's think for a moment of how a vaccine works. The fundamental idea behind a vaccine is that if we are deliberately exposed to a relatively harmless or the dead version of a germ, our immune system will then recognize and eliminate that germ rapidly if it encounters it out in the world. This logic comes from the practice of variolation, which was an essential precursor to vaccination. Say you were a child in China or India at this time who was lucky enough to survive a case of smallpox. A variolator, usually an itinerant folk healer and not a classically trained physician, who charged quite a sum for their services, would collect some material from your smallpox sore. Remember, this is a key way in which smallpox spread, and then use these scabs to produce a mild but protective infection in other children. The technique differed. It was administered through nasal insufflation in China and cutaneous incision into your arm in India. So if I was a child being variolated in Canton, I would snort your scabs up my nose. And in Calcutta, the variolator would scratch it into my skin, very much like a modern-day vaccine. Both techniques were equally effective. So this technique of variolation was carried from China and India into the Ottoman Empire and introduced through the advocacy of a heroic lady, Lady Mary Montagu, into Britain. Variolation then spread across much of Europe, also to North America, and this innovation from Asia led to substantial decreases in mortality across other parts of the world. This is Edward Jenner, and he is credited with inventing vaccines. When he was 8, Jenner was inoculated like thousands of other children in England. Later, as a doctor in rural England, interacting closely with dairymaids who had a reputation for being specially beautiful, the reason they did not have a, quote, ugly, pock-marked face, they reported to Jenner, was because they were protected from smallpox because they had gotten cowpox. Now, exposure to cowpox was a pretty nasty disease if you were a cow, but it was quite benign if you were a human, and it protected you against smallpox. Jenner took this folk wisdom and replaced the variolous matter, the smallpox scabs that were used in variolation, with matter from the pustules of the cow. Voila! Variola vaccinae, Latin for smallpox of the cow, the world's first ever vaccine in 1796, which coined the term vaccine itself.